Just days before Christmas, and South Africa is caught firmly in the second COVID-19 wave, and our healthcare system is taking strain. Over 24,000 people have died since the first case was announced. Reporter Manqoba Mchunu is outside the Charlotte Maxeke Hospital in Johannesburg. Siphamandla Goge is in Polokwane and Nobesuthu Hejana in the Western Cape province outside the Tygerberg Hospital. Manqoba, let me start with you as far as Gauteng is concerned. The concern is when holidaymakers return in January. What's the sense? Is the province ready then to deal with those infections?
Well, certainly, Jeremy, authorities quite concerned about the January period, and this is because many people have travelled to the coastal areas and to other provinces, Jeremy, as part of their holidays this festive season. So they're really concerned that there could be a spike in the numbers come January when those holiday makers do return to the province. But in terms of what authorities are saying, they're saying that they believe that they have quite enough capacity to deal with the second wave of COVID infections. In fact, saying that there is a resurgence mitigation plan that is currently before the Gauteng Premier, and of course it has been approved by the Gauteng Command Council. And part of that, Jeremy, is that there will be an additional 2,000 beds that will be made available from all the public hospitals here in Gauteng. But in terms of, Jeremy, the issue of staffing, that remains a major concern, especially for healthcare workers here in the province, who say that they simply don't believe that they have enough staff to deal with the second wave of infections. In fact, saying that they're quite adamant that there will be quite a big impact come January because of the issue of staff shortages. But of course, the DA also agreeing that while it seems there is a plan, the issue of staffing remains a major concern, simply because many of those healthcare workers are stretched to capacity. Take a listen, Jeremy, to what Jack Bloom, the DA Shadow MEC for Health in the province, had to say.
I think the problem is staffing. I think that there are enough beds. The province has built 2,000 extra beds. I don't know if they're located in the right places, but I think that the beds are there, but I don't know if there's the staff. And especially over the festive season, people have gone away, and I'm really worried. But at the moment, there's 1,700 COVID-19 patients in Gauteng hospitals. That's private and public. At the height of the epidemic in July, we had 7,500 in hospitals. So I think that tells you that we've got capacity for 7,500. They managed to cope, but I don't think we want to get as bad as that. I would still stress prevention mechanisms. But the other option, of course, is that the public sector should pay for public patients to be treated at private hospitals. There is an arrangement in the Western Cape to do this. I think this makes sense. And my problem is I don't think that Gauteng has made a similar arrangement with the private hospitals here. But I do agree that the problem is actually staffing. The beds are there, but where are we going to get the staff for all that? That's where I think there's been a lack of planning.
Now let me take you live to outside the Tygerberg Hospital in Cape Town. Nobesuthu Hejana, good afternoon to you. The province there, is it coping with the increase, and how are these numbers impacting then on hospital operations?
Well, Jeremy, the Provincial Health Department says about 78% of the Cape Metro hospitals, and while 89% of the rural hospitals are facing that capacity, meaning that they are unable to admit more patients. But it further says that about 231 adult care ICU care beds across all hospitals in the province are fluctuating about 80 to 100% capacity on a daily basis. Now, the provincial head of health in the province, Dr. Sadi Karim, he did mention that they are concerned with now that we are in the festive season, because people will be attending those gatherings, and there will be people who are traveling back to the province from the Eastern Capes and other provinces. But we spoke to a nurse as well, who's also a gender practitioner from Denosa, and this is what she had to say about their concerns as nurses working during the second wave.
Right now, at the moment, I'm so concerned about the nurses in the hospitals all over in the province, because why I feel so traumatized. One of my colleagues just this morning came on duty, and if you just look on Facebook right now, They were just walking her out, and she is dead. Her family didn't see her. They saw her this morning when she left home. And it's, you know, for me as a gender leader in the province, it's really very hard. Although we have ITs here, you know, for counseling for the nurses and all the other people, you know, if I say all the other people, I mean porters, securities, everybody that's on personnel who's working for the government right now in the second wave. We are so traumatized because we are scared what is going to happen, who's the next one, you know. So for us, this right now at the moment, this is really very scary.
The third province I want to focus on this lunchtime is Limpopo. Siphamandla Goge, good afternoon to you. What have doctors been telling you?
They are scared of the second wave. They say as much as they were able to deal with the first wave, but in terms of how this virus is behaving when it comes to the second wave, they are scared. Limpopo may not be classified as a hotspot for now, but it's on high alert simply because authorities in this province are worried about people who will be traveling back to the province from other provinces such as Gauteng, and also people who will be embarking on domestic tourism. As we know that Limpopo is one of those provinces that attracts a number of tourists during this festive season. We are outside Pietersburg Hospital in Polokwane. This is one of the hospitals that has been set aside to basically welcome COVID-19 patients, and it's one of the two referral hospitals in this province. Earlier on, we spoke to the health MEC in the province who said they are concerned and worried about the number of positive cases involving young people, particularly from the past weekend. We spoke to the South African Medical Association President, Dr. Sizeka Maweya, who told us that doctors are overstretched, and that is a sentiment that is shared by Dinosa in the province. But let's listen to Sama President explaining.
They are trying to stay safe as possible as they can, but unfortunately we are getting this second wave, which makes us to be more cautious than before, because the strain apparently is different from the previous one. We are really concerned as doctors, but we just hope that the government will provide the necessary PPEs, as it's not different from the previous. Fortunately enough, in the country, we never had that much of a problem in this province in particular. But in other provinces, there were challenges of PPEs, and we are really concerned about that. But we have to take all the serious precautions. As we speak, we are getting new COVID cases amongst ourselves as well, even in this province as we speak.
And that's where we stand with the second wave of COVID-19.